Below are 50 MCQs on heme catabolism and jaundice with answers and one-sentence rationales, tailored for applied biochemistry for nursing. Number 50 MCQs on heme catabolism and jaundice, each includes answer plus one-sentence rationale. Heme catabolism pathway 1 to 20. 1. The first step in heme degradation occurs in the kidney, B. spleen, C. liver, D. intestine. Answer B. Rationale. Senescent RBCs are broken down mainly in the spleen. 2. The enzyme that converts heme to biliverdin is A. Biliverdin reductase, B. Heme oxygenase, C. Ferrochelatase, D. Hemoglobinase. Answer B. Rationale. Heme oxygenase opens the heme ring to form biliverdin. 3. The green pigment formed during heme degradation is A. Bilirubin, B. Biliverdin, C. Urobilin, D. stercobilin. Rationale. Biliverdin is the green intermediate. 4. Biliverdin is converted to bilirubin by A. NADPH, B. Biliverdin reductase, C. Bilirubin oxidase, D. Heme reductase. Answer. Rationale. Biliverdin reductase reduces biliverdin to bilirubin. 5. Unconjugated bilirubin in blood is transported by A. Albumin, B. Transferrin, C. Hemoglobin, D. Ferrin. Rationale. Unconjugated bilirubin is water-insoluble and binds albumin. 6. Conjugation of bilirubin occurs in the A. Spleen, B. Kidney, C. Liver, D. intestine. Answer C. Rationale. Hepatocytes conjugate bilirubin with glucuronic acid. 7. The enzyme responsible for conjugating bilirubin is A. UDP glucuronyl transferase, B. Glutathione reductase, C. Biliverdin reductase, D. catalase. Answer. Rationale. UGT attaches glucuronic acid to bilirubin. Conjugated bilirubin is also called A. Direct bilirubin, B. Indirect bilirubin, C. Free bilirubin, D. Albumin bilirubin. Answer A. Rationale. Conjugated bilirubin reacts directly in the Vandenberg test. Non-conjugated bilirubin is also known as A. Direct, B. Indirect, C. Soluble, D. Delta bilirubin. Answer B. Rationale. It reacts only after alcohol addition. 10. In the intestine, conjugated bilirubin is converted to A. Urobilinogen, B. Hemin, C. Iron, D. Porphyrin. Rationale. Bacterial enzymes convert bilirubin to urobilinogen. 11. The brown pigment in stool is urobilin, B. stercobilin, C. bilirubin, D. biliverdin. Rationale. Stercobilin gives stool its brown color. 12. Urobilinogen absorbed into blood is excreted by the A. liver, B. kidney, C. skin, D. pancreas. Answer. Rationale. Urobilinogen is oxidized to urobilin and excreted in urine. 13. A rise in unconjugated bilirubin suggests impairment in A. bile excretion, B. hepatocyte uptake, C. hepatic conjugation, D. both B and C. Answer D. Rationale. Indirect bilirubin increases when uptake or conjugation is defective. 14. Excess hemolysis increases A. Conjugated bilirubin, B. Unconjugated bilirubin, C. Stercobilin only, D. None. Answer B. Rationale. Hemolysis overwhelms the liver, raising unconjugated bilirubin. The pigment responsible for yellow discoloration in jaundice is A. hemoglobin, B. urobilin, C. bilirubin, D. biliverdin. Rationale. Bilirubin accumulates in tissues. 16. Kernicterus occurs due to accumulation of A. Conjugated bilirubin, B. Unconjugated bilirubin, C. Urobilin, D. stercobilin. B. Rationale. Unconjugated bilirubin crosses the immature BBB in newborns. Neonatal jaundice is mainly due to low levels of A. albumin, B. heme oxygenase, C. UDP glucuronyl transferase, D. biliverdin reductase. Answer C. Rationale. Newborns have immature UGT activity. Phototherapy works by converting bilirubin into A. Conjugated bilirubin, B. Water-soluble isomers, C. Urobilinogen, D. stercobilin. B. Rationale. Light converts bilirubin to isomers excreted without conjugation. 19. Delta bilirubin refers to bilirubin bound to A. globin, B. iron, C. albumin covalently. Answer C. Rationale. Covalently bound conjugated bilirubin is delta bilirubin. 20. The rate-limiting enzyme in heme degradation is A. heme oxygenase, B. ferritin, C. UGT, D. biliverdin reductase. Answer A. Rationale. Heme oxygenase catalyzes the first and regulated step. Jaundice types. Causes and tests. 21 to 50. 21. Prehepatic jaundice is mainly due to A. hepatitis, B. bile obstruction, C. hemolysis, D. cirrhosis. Answer C. Rationale. Excess RBC breakdown raises unconjugated bilirubin. 22. Obstructive jaundice leads to increased A. unconjugated bilirubin, B. conjugated bilirubin, C. stercobilin in stool, D. urobilinogen. Answer B. Rationale. Conjugated bilirubin cannot reach the intestine. 23. Clay-colored stools are seen in A. hemolytic jaundice, B. hepatocellular jaundice, C. obstructive jaundice, D. neonatal jaundice. Answer C. Rationale. Lack of stercobilin causes pale stools. 24. Dark yellow urine is characteristic of A. Unconjugated bilirubin, B. Conjugated bilirubin, C. Urobilin, D. Stercobilin. Answer B. Rationale: water-soluble conjugated bilirubin appears in urine. 25. Hemolytic jaundice shows increased A. Urine bilirubin, B. Stool stercobilin, C. Conjugated bilirubin, D. Serum alkaline phosphatase. Answer B. Rationale: more bilirubin reaches intestines, more stercobilin. 26. Vandenberg test measures A. Urobilinogen, B. Serum bilirubin, C. Hemoglobin, D. Iron levels. Answer B. Rationale: it distinguishes direct and indirect bilirubin. 27. Direct bilirubin reacts in Vandenberg test. A. Only with alcohol, B. Without alcohol, C. Only after heating, D. Only with HCl. Answer B. Rationale: conjugated bilirubin reacts directly with diazo reagent. 28. Indirect bilirubin requires alcohol in Vandenberg test because it is A. Conjugated, B. Water-soluble, C. Protein-bound, D. Oxidized. Answer: Rationale: unconjugated bilirubin is tightly albumin-bound. 29. A biphasic reaction in Vandenberg test suggests A. Hemolytic jaundice, B. Obstructive jaundice, C. Mixed hepatocellular jaundice, D. Healthy state. Answer C. Rationale: both direct and indirect bilirubin are elevated. 30. Elevated ALP is mainly seen in A. Hemolytic jaundice, B. Neonatal jaundice, C. Obstructive jaundice, D. None. Answer C. Rationale: ALP rises due to cholestasis. 31. Urobilinogen is absent in urine in A. Hepatitis, B. Hemolysis, C. Obstruction of bile duct, D. Neonatal jaundice. Answer C. Rationale: no bilirubin reaches intestine, no urobilinogen. 32. Excess urobilinogen in urine is characteristic of A. Hemolytic jaundice, B. Obstructive jaundice, C. Neonatal jaundice, D. Drug-induced jaundice. Answer A. Rationale: more bilirubin enters intestine, more urobilinogen. 33. Hepatocellular jaundice shows A. High direct bilirubin only, B. High indirect bilirubin only, C. Both direct and indirect bilirubin, D. Normal bilirubin. Answer C. Rationale: liver cell damage affects uptake, conjugation, and excretion. 34. Which jaundice has the highest unconjugated bilirubin? A. Hemolytic, B. Obstructive, C. Hepatic, D. Neonatal. Answer A. Rationale: hemolysis overwhelms conjugation capacity. 35. Conjugated bilirubin in urine indicates A. Normal function, B. Liver or bile duct disease, C. Hemolysis, D. Anemia. Answer B. Rationale: conjugated bilirubin appears only when hepatobiliary disease exists. 36. A common cause of obstructive jaundice: A. G6PD deficiency, B. Gallstones, C. Malaria, D. Thalassemia. Rationale: gallstones block bile flow. 37. Gilbert syndrome is due to deficiency of A. Heme oxygenase, B. UGT enzyme, C. Biliverdin reductase, D. Albumin. Answer B. Rationale: UGT mutation reduces bilirubin conjugation. 38. Crigler-Najjar syndrome type 1 causes A. Mild jaundice, B. Severe unconjugated hyperbilirubinemia, C. Conjugated hyperbilirubinemia, D. No jaundice. Answer B. Rationale: complete UGT deficiency causes dangerous UCB accumulation. 39. Dubin-Johnson syndrome leads to A. Unconjugated hyperbilirubinemia, B. Conjugated hyperbilirubinemia, C. No bilirubin change, D. Only stool changes. Answer B. Rationale: defective canalicular transport prevents excretion of conjugated bilirubin. 40. Rotor syndrome differs from Dubin-Johnson by absence of A. Hyperbilirubinemia, B. Conjugated bilirubin rise, C. Pigmented liver, D. Unconjugated bilirubin rise. Answer C. Rationale: Rotor syndrome lacks the dark liver pigmentation. Hatter 41. Hemolytic jaundice shows normal A. Urine bilirubin, B. Serum bilirubin, C. Stool color, D. Urobilinogen. Rationale: UCB is water insoluble and not excreted in urine. Which jaundice shows very high conjugated bilirubin? A. Hemolytic, B. Hepatic, C. Obstructive, D. Neonatal. Answer C. Rationale: bile obstruction causes buildup of conjugated bilirubin. 43. Painful jaundice with fever and itching suggests A. Viral hepatitis, B. Hemolysis, C. Obstructive jaundice, D. Neonatal jaundice. Answer C. Rationale: obstruction causes biliary colic and pruritus. 44. Hepatitis most commonly elevates ALP, AST, and ALT, D. Urea. Answer B. Rationale: liver cell inflammation elevates transaminases. 45. Which form of bilirubin crosses the blood-brain barrier? A. Conjugated, B. Unconjugated, C. Delta, D. All forms. Answer B. Rationale: unconjugated bilirubin is lipid-soluble. 46. Kernicterus risk increases with A. Hypoalbuminemia, B. Hyperalbuminemia, C. High ALP, D. Elevated conjugated bilirubin. Answer Rationale: low albumin increases free unconjugated bilirubin. 47. A sign of prehepatic jaundice: A. Pale stools, B. High urine bilirubin, C. Normal liver enzymes, D. Fluctuating ALP. Rationale: hemolysis does not damage liver cells. 48. Which is absent in obstructive jaundice? A. Serum conjugated bilirubin. B. Urine bilirubin. C. Urobilinogen. D. Elevated ALP. Answer C. Rationale: no bilirubin reaches the intestine. 49. Pruritus in obstructive jaundice is caused by retention of A. Bilirubin. B. Bile salts. C. Hemoglobin. D. stercobilin. Rationale: bile acids accumulate in blood and irritate nerve endings. 50. The most accurate indicator of bile duct obstruction is A. GGT, B. AST, C. ALT. LD answer. A rationale: GGT is highly specific for cholestasis. Thank you. Have a nice day.